There we go. Okay, recording has started. And then when I go into presentation mode for the PowerPoint here, you'll be able to see the slides, but it'll be hard for me to see the chat box. So I want to make sure that your questions are answered as we go. So please stop me as I'm chattering on and ask your questions so that I make sure that you know, your questions are being answered as we move. So, all right, we'll start the slideshow. So any questions right now before we actually get started? Okay, hearing none, here we go. So first of all, I think there's some just basic advocacy 101 things that we probably need to cover before we get into the specific legislative priorities for Prevent Child Abuse Iowa for this year. And we've got them listed right here. First of all, advocacy always begins at home. So you might know that Prevent Child Abuse Iowa is located in Des Moines, and it's great that we're so close to the Capitol. And we work hard to connect with leaders of committees and departments to make sure that our message is being heard. And our legislators are always very receptive to meeting with us, but they're not as receptive to meeting with us as they are meeting with you, especially in their home districts. So we always encourage folks to take a minute to meet with your legislators in your home district. Almost all legislators have some kind of a community forum or a coffee once a month or something like that, where they do a listening post or something going on in your community pretty much monthly to meet with your legislators. And so when those opportunities come about, we really encourage you to take some time to attend those things and to ask good questions and to bring along some information, whether it's information about your agency and the issues that you're concerned about, or if it's information about some of the legislative priorities we're going to talk about today. But bringing information and then asking good questions, legislators want to know. They're not experts in everything, and they look to their constituents to help advise them on how those decisions impact their communities at home. So you are a very valuable part of their leadership. The next thing, a philosophy that we have at Prevent Child Abuse Iowa is collaboration. We collaborate, we collaborate, we collaborate. And when it comes to education at the State House, where we're providing education to decision makers, or you know, whatever advocacy work that we can do, we always come with more of a coalition perspective. So we always say that we represent 76 child abuse prevention councils around the state. And if there's a particular issue that we know one of our councils is concerned about, we work really hard to make sure that we highlight the concerns of that council. But we also collaborate with other partners. So when we're coming to the table, quite often the things that we're talking about include other agencies in the child abuse or the child and family well-being sector. And we think that's really important, and we encourage you to do the same. But when we meet with legislators, we like to notify them ahead of time and make an appointment. And if you're going to meet with the legislator, we would encourage you to do the same. So if you're participating in a lobbying day or any kind of a day on the Hill, or you just want to come to the State House, legislators are very accessible and they do want to talk with you, but it's helpful if you can make an appointment and again, bring information. And when talking to legislators, our goal is to be good listeners. So asking them questions about their thoughts about an issue and then listening to their answer, asking if you could help them listen to what they're saying they need help with, really helpful in the advocacy and education arena of legislators. So we at Prevent Child Abuse Iowa have done quite a bit of work of understanding how is it best for us to frame a message so people can hear it and want to get on board. There's a lot of research behind message framing, and if there's nothing that you take away from this presentation today, it is this. Start every statement, every ask with a perspective of a shared value. So for Prevent Child Abuse Iowa, our value is that all kids deserve to be raised in safe, healthy communities. Everyone pretty much, I haven't met anyone who thinks that's otherwise, most people share in that value. So the shared value statement is always the first statement, whether it's an email, a phone call, or a face-to-face. You want to get on the same page with somebody, and usually that's through a shared value statement. And then the other framework for communication is, you know, legislators are happy to listen to problems, but it's helpful if they can also find solutions. So if you come to them with a solution, it's always a much better conversation. Here's what we think could be done about this issue in our community. And here's why. And the why component is that it's data driven. Legislators like making decisions around data. We like making decisions around data here at Prevent Child Abuse Iowa, and I know your own agencies do as well. And again, that collaborative approach, so it's not just you showing up, but you and your community. And of course, our goal, our outcome, what is this? Again, shared value coming back again. We all want a more resilient Iowa. We want a healthier Iowa. We want you know, a safer community for everyone to live in. So again, positive, solution-based, data-driven. Doesn't mean you can't talk about the problems, but you're talking about them in data frameworks. And then you know, that's our end goal, more resilient Iowa. So are there any questions about how we frame our message here at Prevent Child Abuse Iowa and what might work for you?
Liz, I don't have any questions, but I'm wondering if you'd be able to mute everybody, and then if they want to jump in, they'd have to unmute themselves, but they'd have that option. I'm just getting a lot of feedback.
I guess I would ask other people to mute yourselves and then unmute yourselves. If I mute you, I don't think you can, if you're on the phone, you can't unmute yourself. So if you're on the phone, if you could please mute yourself and then unmute when you want to participate, that'd be great. Okay, cool, great, awesome, here we go. Okay, so now we're going to talk about what are our legislative priorities for 2019. So our goal is that we strengthen families for Iowa's future. That's our value statement. We believe that healthy, vibrant communities provide nurturing environments for kids, and that a statewide network provides expertise in child abuse prevention to create a stronger, healthier Iowa. So we are part of the solution. When we talk about, so there at the link at the bottom, that's a link to our legislative initiatives, and this PDF will be shared for the webinar. So all of our legislative priorities tie into one of the 5 protective factors that strengthen a child's environment and reduce the risk of abuse or neglect. So whenever we're supporting legislation, the lens we use is, does it fit into one of these 5 protective factors? There's a lot of legislation out there and a lot of it is great for families. And if we can't find a way for it to fit in one of these 5 buckets, then we don't usually include it as one of our priorities. And we would encourage you to use a similar lens if you're in the child abuse prevention world, that everything we do, we want to tie back to one of these 5 protective factors. So our first legislative priority is resiliency. And I'm going to tell you all of our priorities this year are very similar to last year. We want to support legislation that helps develop a more trauma-informed, resilient Iowa. And in fact, last year, this is the area where we were able to say, yes, we would like to see the suicide prevention bill happen. And oh, by the way, could we also include 1 hour of trauma-informed training for all teachers? So there are lots of bills out there, and those that are tied to trauma-informed practices, those are the ones that fall into the resiliency framework. We have not done an inventory yet of all the bills that have been proposed to determine which will fall under resiliency, but this is an overarching goal for us. Okay. The next legislative priority that we're bringing forward is a mandatory reporter training. So you might remember that a couple of years ago, PCI Iowa did some pretty extensive research around mandatory reporting practices in our state. We actually did this in response to a couple of extreme child abuse cases in our state where there were claims that there were lots of calls and lots of signs, but maybe not enough was being done. And when we found out about the phone calls that had been made and who was making the calls to report abuse, it was a lot of mixed reviews about whether or not those calls were being received as they should have, or whether the mandatory reporters were saying the things they needed to say to report around the neglect and abuse in a way that would drive action from DHS. So it seemed to be a pretty muddy mess. So we made a recommendation that the legislature convene a legislative study group to evaluate the efficacy of our current mandatory reporter frameworks in Iowa and what could be done to improve them. So the mandatory reporter work group bill passed. And so over the summer, the mandatory reporter work group met 2 times during the interim and has published a summary report. And Prevent Child Abuse Iowa would ask that that summary report be supported and that there would be legislation enacted to support those recommendations. And we'll talk a little bit later about specifically what those recommendations are. The link at the bottom here is a link that provides a more comprehensive talking point white paper on the mandatory reporter work group. Are there any questions about this legislative priority at this time? Okay. The next legislative priority for Prevent Child Abuse Iowa is homeschool registration. Again, this is a carryover from last year. Again, in response to the deaths of 2 girls in our state, but also their siblings, both of them had each 2 siblings that were also homeschooled and neglected severely. Since that time, there have been other arrests of other parents who have supposedly been homeschooling their children, but in fact have basically imprisoned them in their rooms and denied them the sort of education and basic needs that every child deserves. So Prevent Child Abuse Iowa is asking that the legislature require all families that homeschool their children to present their child 1 time per year in person to their superintendent's office to register as a homeschooled student. This is not an ask of can teachers come into the homes of parents. It is a simple ask of we want kids in front of a mandatory reporter 1 time per year. So there's somebody that can do a 5-minute or 2-minute wellness assessment and just lay eyes on a kid that they're in physical health and they're being cared for by someone. So our homeschool registration bill, we don't have a champion yet, but this continues to be an area of education for us, and we think it's critical to the safety net of our kids in our state. I can tell you that the Iowa Association of School Boards supports this legislation, as do others within the legislature that we've identified, but we are still seeking some additional support and our legislator to author a bill. So are there any questions about homeschool registration? Okay, then the last legislative priority we have is around sexual abuse prevention. There have been many bills that have been introduced into the legislature over the last 3 to 5 years around sexual abuse prevention, and all of those bills have been directed at educating children about how to protect themselves from sexual predators, or educating children on how to report after they've been abused. While those are valuable pieces of legislation, our argument is that it's not a child's responsibility to protect themselves from abuse, it's the adult's responsibility to protect children from abuse. And while we would want children to be educated in those skills, we wouldn't want it without the education of adults as well. So our push is that there would be sexual abuse prevention training for all educators. So if we're going to have a comprehensive K-12 human growth and development, sexual assault, education for kids. And we shouldn't do that without also the adults having something similar, having the education they need to better identify grooming behaviors among their peers or coworkers, how to better intervene, how to report. The data on the number of educators willing to report is very low. And they just don't know, or they don't want to get involved. Well, we can solve the just don't know part with some training. So that's our priority around sexual abuse prevention. And again, we have legislation in support of this bill. We've had versions of this brought forward in the past. The feedback is unfunded mandate. So we want to make sure that we're positioning the statement appropriately, and that funding for this actually saves districts money. There's millions of dollars that are paid out every year to families who file lawsuits against districts for the abuse of their kids by teachers and volunteers and coaches. And it's in the best interest of our community and our well-being. I saw my chat alarm went off, but again, when I'm in presentation mode, I can't see what's in the chat. So if you have a question, I'll pause right now and open it for questions or comments.
Liz, this is Cindy Durkoff, and I just wanted to make sure, were you going to send out the PowerPoint so we can get those links?
Yeah, and all these links are on the PCA Iowa website. So if you go to the PCI website and go under advocacy, you'll see the 2019 legislative priorities. But yes, anybody that signed up today or RSVP'd or emailed me or whatever will send this out, yes.
Okay, thank you.
Yeah, no problem. And I'll tell you that our white papers on our websites, we've applied that messaging framework that we talked about at the beginning. We want to start out with a shared value. We want to talk about the issue and data, and then we want to show, solutions, and that we all want, the best interest of our kids as the closer. So that's the way these white papers are written. We encourage you to steal from them, copy them, put them in your own newsletters or sections of them in your own newsletters or on your social media or in your own conversations with legislators. Print off copies, send it to them. We've done a lot of work in pulling some of that data together, and we want to make sure you're equipped to tell the story. Okay, so here's how we stay connected. So we're committed to having advocacy webinars 1 time per month. So the next advocacy webinar, we should have bills attached to each of these priorities. If you're unfamiliar with the legislative process, there's something called a funnel that happens. The way that works is that a piece of legislation must pass out of its committee, and before it can get to the larger governing body. So if a bill is within the Health and Human Services Committee, it first goes to a subcommittee of 3 people. They review it, and if they like it, they'll bring it back to the larger committee and say, yeah, we need to talk about this. The larger committee will discuss it, and then they'll vote and decide whether or not they think, yeah, this is something that we should really consider passing. And if they do talk about it and they do vote on it, then it would go to the larger governing board. So if it was on the Senate side, it would go up to the Senate and they would vote on it. House side, it would, same thing. Well, in order for a bill to make its way in our system, it's got to pass through the Senate or the House, wherever it starts, by a deadline. And if it doesn't pass by that deadline, it's essentially dead. So there are some critical times in the legislative process where a bill might be under consideration, but other priorities take precedence and the bill gets pushed off to the side. And we've had that happen last year and the year before, where things that we just didn't think were a priority or couldn't make it through, other things stepped in the way, the clean water, for instance, or the Chapter 20 for, union labor negotiations. Those things happened over the last 2 legislative sessions, and they consumed a lot of time from legislators. And I will expect that the Children's Mental Health Board recommendations are going to consume a lot of time for a lot of committees, and it may stall some of our legislative priorities. The only way to get around that is to basically hound your legislators to make sure that they're bringing these issues to the forefront and tell them why. Why is this important? So our advocacy newsletters will keep people abreast of that. Anybody that's signed up for our newsletters will get our blasts, our email blasts, and asking you to, pay attention to this. Here's what's coming. Make a call to your legislator. And when we say make a call, we really do mean make a call. More and more we hear from legislators, they just don't answer their emails. And if it looks like it's a form letter, they just put them all in the trash. So a phone call, leave a message. Hi, I'm Jane Doe. I am from ABC County, and I am calling in regard to Senate file blah, blah, blah. And if you'd like some more information about it, please contact me. Here's my phone number. Or I'd really like you to consider la da 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 in that bill. And please contact me. Here's my phone number. They listen to those. And so phone calls seem to be the only way to really get through legislators these days, because they're just, overwhelmed with emails, thousands of emails every day. Another way to stay in touch with what's going on is subscribing to the Legislative News Service. That's an agency that provides daily updates of the action happening at the State House. And then asking you to leverage your social media. There is one thing that elected officials do pay attention to, and it is social media. So as much as you can, create that snowball effect of the issues that are concerning to us, social media in a positive way can be very effective. We wanted to let you know about some upcoming Days on the Hill. When Prevent Child Abuse Iowa has had a Day on the Hill in the past, it's been very challenging for our network outside of the Des Moines metro area to get here, because the legislature meets in the winter. And our, child abuse prevention providers, pregnancy prevention providers, Connections Matter trainers, they're out in the field doing their jobs, and that's where we want them. So we've decided that instead of calling everybody, together and traveling on icy roads, it might be better just to latch on to some other advocacy days, some other days on the Hill. So we've listed a few of them here for you. The last few years, we've blended with the United Ways of Iowa Day on the Hill, the Central Iowa ACES Lobby Day. We've historically blended in with them. And then the 211 Awareness Day is another opportunity that we've worked together. So if you're able to participate in any of those sessions, I would highly encourage you to do that. But what's most important is that you're meeting with your legislators in your home district, when you're not one of thousands, you're maybe one of 10 or 15 people at a meeting. So let's talk a little bit more in detail about some of these bills that we expect to see coming forward. The first one is the Mandatory Reporter Training and Certification Work Group report. And as mentioned previously, that's an outcome of the study group that met in the interim. And I can just very briefly summarize for you what was in that recommendation. And if you want to find the report, you can just simply Google Mandatory Reporter Work Group Iowa. You'll get right to the website, and the full report is available to you there. And they really smartly put the executive summary right at the front, so you don't need to read the whole thing. But in summary, I'll tell you that there are about 400,000 Iowans who are required to be mandatory reporters. And when we think about mandatory reporters, I think in the child abuse prevention world, we think that just means, people involved in serving children. But in fact, it also includes people involved in serving dependent adults. And so talking about mandatory reporting involves an adult conversation as well. And that came out in this session. And what was learned by me, and maybe many of you already knew this, but the current mandatory reporter training is required to be 2 hours long and include both adult and child. Well, there's a very, very small percentage of Iowans who are required to take both trainings. In fact, most people are required to take one or the other. So our current training is about an hour of time on a topic that doesn't pertain to your job. So DHS suggested that those two trainings be separated, that people who are required to take child abuse mandatory reporting just take that, and people are required for dependent adult just take that. And in their assessment, the two are different enough that they really should be separated. and that there is little to no overlap other than the very introduction of this is a mandatory reporter training, and after that, everything else is very different. So they suggested 2 separate trainings, and those would be 2 separate 2-hour trainings. Again, most people only required to take one, a very small fraction of people required to take both. The second thing is that DHS recommended that 5 years was far too long to wait to have an update in mandatory reporter training. And they said that because there are so many legislative changes that happen year to year that a 5-year span really leaves out and puts at risk a lot of children and adults if their mandatory reporters are unaware of the legislative changes. So they recommended that the renewal of mandatory reporter training happen not every 5 years, but every 3 years. So to summarize so far, we have 1 2-hour training being split into 2 2-hour trainings and people only being required to take the one that pertains to them. And the second recommendation is moving the renewal from every 5 years to every 3 years. The third change, which is a substantial change, is that everybody be required to take the same training. Currently in our state, there are more than 4,000 different trainings offered for mandatory reporter. That's a lot. It's very poorly supervised, and public health says we don't really supervise. If they fill out the form right, we give them a number that, yep, you're certified, and off they go. So having one consistent training that's available online, free of charge, is probably the most significant change. So DHS is in the process of developing that framework. They've contracted with Iowa State University to help them put it online. And by putting it online, it achieves several goals. First of all, everybody's speaking the same language, so we don't have umpteen different versions out there. There's just one version. We have an accounting of who's taken the mandatory reporter training. At this point in our state, we have no idea who has actually taken the training. It's kind of on your honor. So when people take the online training, they will log in, and then the state will know that Liz Cox took the training, which is a benefit, because when legislative updates happen, now DHS can send an alert to me because they've got my email and say, hey, mandatory reporter, there's been some changes. Here they are, and they're going to develop a module just for the changes from 2019 legislative session that I can watch so I can stay up to speed on what those changes are. So one universal training available online, free of charge. So there'll be no fee associated with taking this online training. This is a huge leap in our state. And we believe it will improve the quality of the mandatory reporter training and the learning that happens at a mandatory reporter training. So when I say that, I'm saying that there will be intermittent tests throughout the 2-hour training to indicate whether or not the person taking the training is retaining any of the knowledge. So they're learning anything. So you might watch this video or participate online for 10 minutes, and then there'll be a little quiz and you'll answer 2 or 3 questions. And then you'll go on to the next module and you'll watch and participate and learn, and then you'll take a little quiz. And at the end, you'll take a comprehensive quiz. At the moment, in our state, we have no idea if anybody retains their knowledge because there is no required testing or any of that. You just sit through a workshop and then you're trained. So you cannot get mandatory reporter certification in this framework online unless you pass the quiz. So that's a significant change. There are 3 major changes coming in this recommendation, and those changes were all voted unanimously from the committee members. And the committee members represented just about every department across the state of Iowa. So there were people there from the Department of Education and Public Health and Human Services and Corrections and the whole police force and CASA and the AG's office. I mean, there just was a whole table full, and there were legislators there as well. So The expected cost to the state to do this is about $20,000. I did ask, because Prevent Child Abuse Iowa was the only non-government agency invited to participate in the work group. I did ask whether or not this change from every 5 years to 3 years was going to be a hardship to the departments involved. And I also asked whether the 2 separate trainings would be a hardship, knowing that some folks, like police, for instance, would be required to take both. And unanimously, all the departments said no, this would not be a hardship, and they were very much in support of those changes. The $20,000 is actually to develop that software to get those modulars going. And, you know, the money going to Iowa State University, it's sort of right hand paying the left hand, a little bit still stays within the state spending. I asked the legislators, would this be a hardship on the budget for the state? They had some discussion and they agreed this would not be a hardship, that $20,000 was affordable for our state to do this work. DHS has agreed to continue the maintenance fee, which they expect to be $2,500 per year. They're just going to build that into their budget. So we are wholeheartedly in support of the mandatory reporter work group recommendations. And DHS was asked to help develop a bill that the legislators who were assigned to the work group could carry forward. So we would expect that there would be a bill assigned here shortly in support of these recommendations. I will tell you that there was opposition to this work, although it was unanimously supported by members that were participating. There was one agency that was not participating, but they let public input happen the whole time. It was really wonderful. The Hospital Association is really not in support of these changes. And I could go on and on about why that might be, but just so you're aware, the Hospital Association would like to be carved out. And we're disheartened by that notion. Medical providers, there's nobody else in our child welfare system that has total access to the whole body and mind of an individual besides a medical provider. And they are a key partner in our mandatory reporter work and identifying child abuse and neglect early and intervening. So we're working really hard to help build comfort for them that these changes will be good for them too. But that's a summary of the mandatory reporter work group. Are there any questions about that? Okay, all right, then let's talk about the Children's State System Board. I'm hoping that many of you are familiar with that. That would be the Children's Mental Health Board that Governor Reynolds asked to convene and bring forward recommendations for a strategic plan. That group met several times again in the interim. There was healthy discussion at all of those meetings, and the recommendations that came forward are detailed in this report. One of the things that children's mental health providers has lamented is that there's so much passion around a children's mental health system. And when people go to the Capitol and everybody's got their own version or their own talking points or their own, you know, whatever perspective, it creates a lot of confusion for legislators, and it's paralyzing, and so they don't do anything. So there's been some work over the summer by some of those advocates to try to create a general framework, some talking points about why do we need a children's state system and what would that look like. And so those talking points were developed and shared. So if you'd like, we are in the process of converting those talking points into a white paper that'll be on our advocacy page. They just came out last week. But I would encourage you to get familiar with what the state board is recommending. Mental health is closely tied to child abuse prevention. I think that's something that we all really need to share a message in. That mental health conditions are an outcome of child abuse and neglect. Kids that survive abuse and neglect often are later diagnosed with mental health conditions. But also, mental health conditions are a risk factor for abuse and neglect. We know that kids that suffer from disabilities, whether they're physical or mental, are at a much higher risk of being abused or neglected. So there's a very, very close tie between mental health and children's well-being and the prevention of child abuse. So Prevent Child Abuse Iowa is very much in support of a strategic system that addresses the mental health needs of children and their parents. We know that kids that grow up in a household where there's a mental health condition that's been undiagnosed and untreated, you know, that's an ACE. And back to that first slide on resiliency, this is exactly where this sits. We want a resilient Iowa. In order to have that, we've got to have a mental health system that works really well for kids and their parents. So to understand that continuum, that a work group's been meeting. Prevent Child Abuse Iowa is a part of that work group. And this is an outcome, and there'll be others, to help communicate with folks. What do we mean when we're talking about a system? And you notice it's Children's Mental Health for a Resilient Iowa. Notice the positive framework here. There's a solution before us. And those of us who understand multi-tiered systems know that the bottom, you know, the widest part of the triangle is the prevention, you know, and then we've got the targeted and then the more complex needs. Well, we don't have much of any of this going on in our state at all. So we do have home visitation, that's happening, but the screening and assessment and evaluation for mental health really isn't happening. So these are the sorts of talking points or solutions, you know, a way to kind of illustrate where do these services fit. PCA Iowa providing emergency and respite care in our grant funding, but we're just such a small piece of the bigger picture. But this is a good resource to help communicate that message. So I want you to take away from today's conversation that we here at PCA Iowa are working to put together something of an infographic or a briefing and framing the mental health message around child abuse prevention, that we are in support of the children's mental health system. And so I'll just pause there and ask for your feedback or questions on this particular topic. Okay, you're a super quiet group. We'll keep going. So getting back to just kind of wrapping it up then, I hope you can see that each of our legislative priorities directly tie into these protective factors. And we will continue to work to develop support around other bills that come up throughout this legislative session that tie into these 5 protective factors. So that's the conclusion of the webinar. Just wanted to, I'm going to end my presentation now so I can see the chat box if people are chatting. It looks like there might be a couple. Okay, yeah, got that. All right. Are there any other questions, comments, suggestions? What we forget? Okay, so hearing none, I'm going to stop the recording.